All right, from that, let's take you back to our top story and the impasse between the government and donor USAID over the release of the life-saving antiretroviral drugs, that's ARVs, for people living with HIV remains unresolved, with a possible serious crisis pointing to a complete stockout in the next few months. The Ministry of Health maintains that despite the clearance for the consignment stuck at the port of Mombasa, USAID has refused to engage with the ministry. Zainab Ismail has the details.
The lives of 1.2 million HIV patients remain in jeopardy as the much-needed ARV drugs continue to lie at the port of Mombasa, with the dispute between the Ministry of Health and the donor USAID stretching out longer.
We are facing a possible, stockout, and the risks there lie on close to almost 900 patients who've been living with HIV and who require the necessary drugs and medications. When we look at our stock levels and we look at our logistic levels, I can tell you, honorable members, that there is a risk of stockout for some of these commodities, particularly in terms of how we distribute them to the clients in terms of 3 to 6 month refills.
On Wednesday, the Ministry of Health said it had received approval and clearance for the drugs to be released for distribution after the 90 million shilling tax impose after the National Treasury waived the fees. However, Health CAS Dr. Mercy Mwangangi says USAID has remained non-committal on the way forward, leaving the standoff yet to be fully resolved. She says USAID sidestepped protocols in enlisting the private company Kenyans International as a consignee.
One of the key challenges, or rather the biggest challenge actually here, is that we needed and we are required through law to have KEMSA as a consignee of these products and medicines that come in. And therefore, the issue there is the unilateral decision to utilize a private consignee and to proceed with that, and therefore then bring about the current impasse, and of course then the risk of stockouts.
But Chair, I thought you only needed to pay the tax if those people were bringing in. Now, then why are you now saying the tax issue has been resolved?
Tax issue, yes, tax has been paid, but remember, there's still a consignee who's holding these items, who is not KEMSA.
HIV treatment items are ordinarily received through KEMSA. Imports through private firms do not qualify for special exemptions and are subject to the normal clearance procedure. With KEMSA the centre of one of the country's hugest graft scandals, questions arise over whether this influenced USAID's decision.
It's Dr. is saying that USAID is quiet, nothing is happening, they are not talking. You call a meeting, they don't say anything.
Has there been any formal complaint from USAID, and why the change of, the guard, I would say? Why would they now want to go private instead of using the government commodity and facility?
What time did you realize that USAID was not willing to work with KEMSA and what was planning to engage another private entity?
I can tell you we reached out intensely on whether they would stick towards the KEMSA MCP model or whether there were any other alternative arrangements to be made.
Although USAID has maintained that they are not able to meet the Ministry of Health, I'm aware yesterday they did meet the Council of Governors and they were able to meet. So that means that if they're able to meet the Council of Governors, they're also able to meet us. I take note that the challenge we currently have is the lack of communication.
For now, HIV patients will have to contend with the depleting stocks as the consignment lies at the port, with both the government and USAID failing to reach a consensus. Zainab Ismail, NTV.